So my name's Callie Ellis. I live in San Juan Capistrano right now, and I'm gonna have the gastric sleeve. My family asked why haven't I done this before. I talked to my twin last night and I told her about it, and she goes, "What took you so long? I've been telling you about this forever, to do something extra," because she's like, "You're working so hard and nothing's working." So I was like, I know, it was just me procrastinating. My mom, since she knows I don't do doctors, she goes, "Are you sure?" "Yes, this is what I want." I don't even go to the doctor really. When I do, it's someone's dragging me there for something. So I'm nervous, yes, but then I'm excited because I know what the end result's gonna be. And I know I'm gonna kick myself. Why didn't I do this before? Why did I wait so long to do this? My friends and family are very supportive, very. Even my work is. My supervisor actually is doing the same thing, and she recommended me. She told me that there was this great doctor she found, so I did a bunch of research on him and decided to go with him. But Dr. Feiz came in and told us, right away, I went to school here. This is my specialty. Like some of the other doctors will come in later on and do weight loss. He goes, "This is where I've started. I haven't, detoured or anything. This is where I've started and this is where I've kept going." He does stuff with Cedars-Sinai, and everyone knows that's a huge thing out here, So that kind of was like, oh, okay. That kind of pushed it even a little bit more that he knows what he's doing, and he's like, "If you have any questions, you can just call me and ask." He's actually taking the time and caring about you as an individual. We started talking, and Dr. Feiz has a great personality. Makes you feel like he's basically just talking to you, but yet there's a bunch of people in there. He was like, "Well, let me stop and talk with you real fast. Do you have anything that you want me to answer for you?" I wanted to make sure that I could still have kids later, because I'm 27 and I come from a big family. I'm one of 6 kids. And he's like, "You're fine. I've had 2 patients who had kids within a year. And they were totally fine." Unfortunately, my work schedule is, I kind of never know exactly what days I have off, beforehand, really. So I went to the Beverly Hills office just because they had an opening. Before I even got there, they had already ran my insurance. The day of the consultation, they're like, "Yes, you're fine. Your insurance covered it. And then these are the next couple things that you have to do." So the nutritionist, you have to talk with a psychiatrist. I did mine over the phone, just made it easier because, like I said, with work, who knows when I'd get in. So far, everything is going according to plan. And hopefully, we're hoping I'll get it done. Hopefully the beginning of next month. I want to get this going. My highest was 360. I've lost 80 so far, just by myself, in about 2.5 years. But I just stopped. That's my problem, is I'll lose it and then I'll just stop. And that's where I'm at right now. I'd been dieting my whole life. It was just, my sister was getting married, and I got thrown into the maid of honor position, which I was like, oh, I can't look like this anymore. So that's when I really got really serious and started doing stuff. Went on a really strict diet, and I lost a bunch of weight on that. Then it would yo-yo, because you can only eat this and this, and I can't eat chicken and vegetables 2 times a day for the rest of my life, and that's it. I'm hoping with the sleeve that it won't just stop at a certain point and I can keep going. Well, when you're overweight, you see the pictures and you think, how could I let myself get like that? I saw a picture from Christmas and I was like, how could I let myself do that? Get that big. I didn't even know they took the picture, because when you are bigger, you stay behind the camera. You're the one taking the pictures. You don't want to be in front of the camera. You don't want to see, other people like, "Oh, you're really pretty." And you're like, "Oh, thank you," And inside you kind of know they're just being nice to you, So I always stay behind the camera, take the pictures, and remember it that way versus being in front of the camera, so I don't have to look at myself. I want to be able to be in front of the camera, take the pictures, make the goofy faces with all of my friends. We're going to Disney World in September, and there's 14 of us going, and I'm making someone else take the pictures this time. It's always me who has the camera, who does everything. I'm actually gonna pass it off this time and make someone else take the pictures so I can be in the picture. I can remember and look like, hey, this is what I looked like. We went 2 years ago to Florida, my sister and I have those pictures, and I want to compare them now till afterwards. Like, hey, this is me then, and look at me now. I'm looking 10 times better, and I'm actually glad to be in the pictures, not like, okay, quick, snap the picture and let's go, because I look horrible in it, and I know I do. I'm looking forward to be able to go out and go shopping with the girls. Not have to go to the plus sizes where, the other girls are just going to the regular sizes. I want to be able to go on a hike and not be out of breath, or I'm the biggest person there. I want to be able to go out and go play baseball, not just, sit there and watch it, because you can't run when you're so big. I want to be able to get in a seat plane without having to get an extender. It's the little things like that. Before, I couldn't even fit in some of the rides at Disneyland. Now that I've lost the weight, I can, but I want to be able to be yeah, I can, there's a ton of room. You can fit an extra person in the seat with me. Those are more my goals. They're not huge, but they're mine, and that's what I want out of it.